Hey everyone, I hope you all are doing good and I am Smriti Bhatia and welcome back to my YouTube channel. So in today's video we are going to study about the carrying angle. I was going to make a video on the elbow joint, but I was very busy and was not able to make the notes for the elbow joint, so that's why I made it for the carrying angle. We were supposed to do the carrying angle later on, but we are doing it before doing the elbow joint. So let's start. So what is the carrying angle? For in just layman terms, if we have to understand, then carrying angle is the angle formed between the longitudinal line drawn from the humerus and the longitudinal line drawn from the ulna. So this becomes the carrying angle. Carrying angle. It is also known as the cubital angle. Okay. So the carrying angle, if we go with the BD Chaurasia wise, then it is the transverse axis of the elbow joint. The transverse axis of the elbow joint is directed medially and downwards. That is medially and downwards. Okay. Because of this, the extended forearm is not in a straight line with the arm. This is the forearm. This is not in straight line with the arm, but makes an angle of 13 degree with it. So now 13 degree is not the confirmed degrees. It can be less than 13, it can be more than 13, and it varies from individual to individual. So it is about 13 degrees with it. This is known as the carrying angle. The factors responsible for the formation of the carrying angles are as follows. Now, why is this carrying angle made? Why is this not aligned with the humerus? So, the medial flange of the trochlea is 6 mm deeper than the lateral flange. The superior articular surface of the coronoid process and of the ulna is placed oblique to the long axis of the bone. Okay, so this is obliquely present, and the medial side of the humerus is a bit facing downwards, that is deeper. So it is 6 mm deeper. We can understand it like this. So if this is deeper, the bone will attached in this direction, so it becomes oblique, and the ulna is already present obliquely, so that is why this angle is created. Now the carrying angle disappears in the full flexion of the elbow and also during pronation of the forearm. The forearm comes into line with the arm in the mid-prone position, and this is the position in which the hand is mostly used. Okay, this arrangement of gradually increasing carrying angle during extension of elbow increases the precision with which the hand can be controlled and the objects can be held in it. Okay, so if we go explanation wise, what is the normal carrying angle for males? So it is about 5 to 10 degrees. Mostly we will find 10 degrees in males and 15 degrees in females. Why is it more in females than in males? Why is it so? Because female have wider pelvis. Do you know why? Female have wider pelvis due to the accommodation of their reproductive system. Okay, so this is the reason why the carrying angle of female is more than that of the male. This is a very important point for Viva questions. So just remember this very carefully. Now it allows the forearm to clear the hip during walking. Okay, so now this is the pelvis. It allows the forearm to clear the hip while walking. The arm swings while we walk. They swings in the anterior ways and front and backwards, just opposite to the legs, right? So Cubital angle allows the forearm to clear the hip during walking. What is the clinical significance? What is the clinical significance of the cubital angle? Why are we studying this? So, increased angle is known as the cubitus valgus. The decreased angle is known as the cubital varus. There is no decreased angle found in this, but there is always an increased angle found, that is known as the cubitus valgus. And this cubitus valgus can cause a stretch to the ulnar nerve. Now, where does the ulnar nerve pass? It passes from the posterior side. Okay, I am drawing it anteriorly, but it passes from the posterior side. So, between the medial epicondyle of humerus and the olecranon process. Okay, so it goes medially and posteriorly. So that is why when the cubital valgus is formed, it causes a stretch to the ulnar nerve. It is present medially. If this is increased, if this goes like this, then this nerve will also be stretched and will cause nerve palsy, ulnar nerve palsy. Decreased or reversed angle is known as cubitus varus. It is Gunstock deformity and mostly seen commonly after the malunited supracondylar fracture in the children. When there is a malunion of the supracondylar fracture in children, then Gunstock deformity is formed. That is opposite to the cubitus valgus and is known as the cubitus varus. Okay, so this is all about the carrying angle. The most important Viva questions that examiner can ask are why the female have more cubital angle or more carrying angle than the males. What is the reason? And the question can be asked like, who have the more carrying angle? What is the normal range or the normal degrees of the carrying angle? So this is a very important for Viva aspect also and for theoretical papers also. So that's it for today's video. If you like the video, then hit the like button below and comment in the comment section that who have the wider pelvis and who has the more carrying angle.